Hello, beautiful people. Thank you so much for joining us this evening at our webinar at this queer magical festival with everyone talking about mental health. My name is Nala Latte, aka your host for this evening. I'm a director of Hope, a mental health organization for the Black and Asian community, where we specialize in holistic means of helping the Black organization. I'm also a poet, a choreographer, and a superstar in life. So welcome to our Black Queer Wellbeing webinar. Can I get a round of applause for everyone attending today and for our panel? Thank you very much for being here. For those of with microphones on, please mute them. If you want to speak throughout, please raise your hand. And you can't hear? Can you hear, Simone? Some technical difficulties. I'll carry on. If you put your hands up, someone will allow you to speak throughout. So if you want to also type in the chat your answers, please feel free to put them in the chat. We have a beautiful panel today. I would like them each to say who they are and what they do and their pronouns, please. So can we start with Antoine?
Let's get confused with the mute. Hi, my name is Antoine Rogers. I'm a community activist and an academic. I'm one of the directors of an organization called Evidence to Exist Research Group. And I also run a research project at Brunel University around education interventions for underrepresented groups at university. And longtime sort of Brixton resident. And yeah, that's me.
Amazing. Thank you. Joseph, would you like to go next?
Sure. Hi, I'm Joseph Funnell. I'm an artist, primarily works with dance, movement and film. And I'm also on the side a community activist. I do work mainly around LGBT and migrants' rights. So I work with lesbians and gay supporting migrants and Southwark Day Centre for Asylum Seekers. And yeah, with regards to mental health and wellbeing, I'm kind of working on projects that are linking like somatic practices with helping queer people of colour feel empowered and embodied. That's my line of research at the moment.
That's amazing, thank you. And finally, Simone. Do you have Simone? I think she might have gone. Okay, while waiting for Simone, tonight's event has been commissioned by LD and Thrive and produced by Brixton Reel Film Festival. LD and Thrive are looking to find out how and if COVID-19 made an effect on queer Londoners by creating this survey for you tonight, all to better understand our experiences. Ooh, anticipation. The purpose of this discussion today is to help us understand how COVID-19 pandemic and lockdown has affected queer Black folk. The plan is to go through these questions in the surveys tonight and answer them with you and the panelists. You can find the link in the chat if you want to write it down. As I said, put your hands up if you would like to speak and someone will put you through to us. Feel free to follow the link and answer the survey in your own time if you don't want to do it tonight. But the incentive is added where if you do join tonight, and if anyone who does join the webinar with us is entered into a dinner for two and a cheeky hotel, although that might be taken by me and my girlfriend, so that might be not up for grabs later. But join us tonight and that will happen for you. You get to take that away with you guys. So let's start and go through these questions. They'll pop up on the screen and you can read them with us. Yeah, so let's do this. Question number one. Do we have Simone with us? Is she coming back? No. Okay, question number one. What has helped or made it more difficult to cope with the pandemic and social distancing measures, including lockdown? Antoine, do you want to begin?
Oh, wow. Is it always going to be me beginning? Fantastic. Yeah.
This time round.
I wrote down three things, and when I was answering this question, and I think because they both have helped and made things more difficult. I wrote down my community, helping others, and my privilege. And so perhaps I should probably unpack that a little bit. So
Yeah.
I think in terms of my community is amazing, and where I live is amazing, and knowing so many people locally. But I think that it's also been difficult in that regard, because when you engage with people and understand how they're experiencing it, I think that presents, stuff for you to process. And then I say my community is also, I'm from Chicago, and so it's been a difficult aspect of it, it being so far from home, and had intentions to go home, and haven't been able to do that, and have an elderly foster mother, and all sorts of things that make that very challenging. So my community both gives me strength, but it also makes very real, because my community are people who are incredibly marginalized, and who are, who are facing really difficult things, both here and back home. I say my privilege because I'm an academic. I've been able to keep a job, and in that regard, it has made things very, very easy on one level, but it also makes it difficult to complain when because when you're talking to people who have lost their jobs, or who are sort of dealing with death, and it's a difficult one. So it's one about finding that space to deal with your own kind of anxieties and frustrations within the context of the privilege that you have, secure home and income and all of those sort of things. And again, helping others, I think, is a part of that as well. I get great joy out of, helping and supporting people where I can. But again, I think in that process, there is also an emotional cost, when you know that what you do to help is limited. You'd want to help more, but you can't. And then all three of those things kind of intersect, right? Because you want to help.
You're thinking about a lot right now.
Absolutely. So yeah.
That's amazing. Thank you for sharing. Joseph, would you like to speak?
Yeah, sure. I mean, I almost want to steal your answer, because that was so perfect. But I see a lot of parallels in terms of like community acknowledging my privilege, and also what was the other one? Helping others. Yeah. So I guess just to dial it back a little bit, one thing, I don't know, I just kind of went hard on the self-care. Like as soon as the lockdown happened, I had to kind of take a bit of time and acknowledge what it is that I basically need as a person to try and get through the day. And for me, as a dancer, as a mover, as a performer, I need a lot of physical activity. So exercise was one thing. But then also, as queer people who suddenly, I mean, I guess it's the same for non-queer people, but like suddenly having spaces shut down, suddenly not being able to physically see your community.
Was it hard as a dancer?
Yeah. It was really hard, really weird, especially working like the freelance kind of gig economy, and like having all this uncertainty. But I guess I sort of realized at least one thing that I could do is establish some sort of routine and have some stability in my life. So I kind of started this thing where I just gathered a group of queers and people of color, and invited them, I'd say every day in the morning, I'm doing yoga from this time to this time. Join if you like, we can do it together. And it kind of just, it wasn't like I'm going to teach. It kind of, I mean, I am a yoga teacher, but I was like, I'm kind of doing this for me as well. But just through having that regularity of like seeing people, from your community, and having, yoga for me is like a whole
really helped
body soul rehab situation. So that was like literally the thing that got me through, I think. Maybe I'll say
that nicely moves on to the second question. If you're going to pop up on the screen, I'll read it from the book. Did you feel supported by those around you, and how did this help? So you were talking about the communities you went to go see, and how that really brought you some sort of hope. Even Antoine, you're talking about the communities that make you thrive and gave you hope. If there's any specific people or certain communities that really helped you through this time?
Yeah, I mean, again, I think I'm really lucky in where I live in Brixton. I live in the Brixton Housing Co-op, and there is a quite significant sort of Black queer population. Literally out my back door, out my front door. And also, I'm sort of in my mid 40s now. And I think coming into an age bracket as well, where my kind of peers and people that I engage with sort of range all the way up to 70.
Okay.
I think that that's been really good for me, because I've always, I think, sort of had older people in my life, probably kind of selfishly, to know what's coming, more than anything else. And also, but I think, having older people around me right now, and I say older as in like even like sort of 10 years older than me, who help me to kind of keep it calm,
Yeah.
put things in perspective. I'm lucky as well to have a sort of incredible community of people who have survived HIV for a long time. And you're also, sort of, I'm lucky enough to have people who have lived through a pandemic. And so I think in that sense, I could ask questions, and I could, articulate my anxieties, and I can do so to people who held me and who were willing to do that. So I again, if not for that, and not feeling isolated, because those people are really, really, really sort of, geographically very close to me. I did a similar thing around running. And just sort of getting out and saying, we're going to go out and we're going to, run, a few times a week, Monday, Wednesday, Friday. And that was a really important thing to do as well. So exercise is everything. Yes, Joseph, everything.
That's so interesting, because I feel like during this time, in this lockdown, I was really unwell. So I didn't even think about COVID at all. I was more in my own head about getting through my own illnesses. So when I came out of that, to see the world change, no one was on the road, no one was standing next to each other, there was no hugging, nothing. Like, it was really crazy, because I was not watching the news during that time, so I could just heal and focus on like healing. So for me, I don't know, going to these elders, as you're saying, sounded like something I should have done, because I started to panic, and I was speaking among young peers who hadn't been through pandemics, hadn't been through anything, so this was just like crazy, and they become very depressed and very insecure, and thinking about their careers and what they can't do now. Whereas you're right, when I spoke to my grandma, she was really relaxed about it, as if it was another time in history, because of all the pandemics she had been through, with swine flu, Ebola, even when times were hard for Black people and they were still very racial and abusive. So yeah, I never thought about that perspective. Thank you for sharing. Joseph, do you want anything lastly to add?
What could I add? Yeah, I mean, I guess the whole situation just put a bit of a microscope really on like where your support system is and who to kind of fall back on. And it kind of evolved naturally. I mean, but the reality was also we were all kind of going through some, I don't know, it was this weird kind of leveling situation where we're all going through this pandemic. So there are moments where you have to be providing support, moments where you're kind of asking for support. So it was a strange time, because you're kind of constantly juggling like those two positions. I think, to mirror, I'm just going to copy everything that Anton said, but mirroring, I think, I didn't really think about it at the time, but coincidentally, a lot of like my kind of friends who are a generation above me became a real support throughout this time. And then also, again, going back to what Anton said, I didn't speak about helping others, but LGSM is the activist group that I'm part of, and we would usually meet once a week. So physically, we tried to take those things onto Zoom, and that kind of helped. I think we became more attuned to supporting each other in different ways that we hadn't before. We kind of started having interesting conversations about the dynamic of the group, etc. So I can't really think what my final point was there, but we should probably move on.
Well, thank you. Okay, so question number 3. How can the experiences of the less well-heard groups be better fed into health and mental health social services? So mental health services and social services, so they can be better prepared to support them in the future. I'll read that again. How can the experience of marginalized groups be fed into health services and mental health social services to be better prepared to support them in the future? Joseph, do you want to begin this time?
Yeah.
There you go, mixing it up a little bit.
Yeah.
Oh, shall I start?
Go for it.
Okay, sure. This means I can't copy what you're saying. Basically, I guess there's two sides to that question. On one level, we need to have a situation where the people who are making the decisions, who are, running these services, are representative of the people and the marginalized groups that they hope to serve. So that's one strand, and not kind of in this sort of like, box ticking diversity sort of thing. Like, we need Black people, we need queer people in in the top positions, in positions of power, and who have that lived experience and are able to bring that to the decision.
How do you think that will actually help? What help do you think that will bring?
I think just, having that having at least a sense of the lived experience, or a slight insight to like the issues that our community faces, is just instantaneously going to be less overlooked, hopefully. I don't know, that's hopeful thinking. And then on the other side of things, I mean, there needs to be a sense that these groups are given the opportunity to have their voices heard, to have a procedure in place, to have the infrastructure in place that means that there is a direct line of communication to express why we are feeling certain ways, why we are struggling in certain ways, what help we need, and a sense of security that those comments are being heard. I think finally to wrap up on that, is like the way that things appear to be structured at the moment. We have, health, mental health, social services, all these different services often operating in isolation. We need a holistic approach that there's greater communication to be.
Well, to give you a fun fact, I recently have been having the most amount of arguments with my doctors about changing the way they deal with my medicine. So I stopped taking westernized medicine and asking for a holistic approach. And for years, they were telling me there's no such procedure. But I found out recently by my psychologist that there's actually a procedure in place where they do cupping, they do acupuncture, they do other holistic means of health. So if you keep asking the right questions to the right people, there are things out there, but we just need to get more people fighting and shouting for other means rather than just saying yes to what's given. Do you agree, Anton, or what Joseph was saying?
Totally. I mean, I think that the question is so layered, and I think this is what Carrie may have been alluding to in terms of its kind of white middle classness as such, because I think representation, and I think what Joseph is saying there, is really, really, really important. And because I also think sometimes, and you read a question like that, experiences of less well-heard groups being fed into the health and mental health and social services. I think what we're talking about is how do we get white people to listen to what non-white people are experiencing? I mean, that's what the question is.
Yeah.
And so, I mean, it is some of that basic stuff about training, but I also think, and this is where it gets really interesting for me, around the way in which, I mean, we've all been, sort of impacted by videos. I mean, my goodness, just recently in Kenosha, the videos that we see and the way it impacts on our mental health. And I think that, how do those people who are in those positions understand these experiences? How do they understand the everyday sort of micro kind of levels of aggressions or aspects of life that impact on people's mental health?
Well, my question to both of you and the audience out there, please feel free to write in the chat or put your hands up and have a little chat with us. My question is, do we need them to understand in order for there to be a change? Everyone's fighting for them to understand and learn from our experiences and be part of our experience. Well, my biggest question is, do they need to understand? Will they ever understand for us to demand change and get change out there?
I mean, sorry to stop in there, but the reality is they're never going to fully understand. They can perhaps, sympathize or empathize to a good degree, but they're never going to understand. I think, I don't know what this kind of goal of like, we need to get people to fully understand it's really going to go. It's about listening and accepting the facts, the history, the present, and putting protocol in place to address that. For me, I don't know.
Yep, and Antoine?
I wanted to say something, but I didn't know how much Simone had heard of the conversation and maybe bringing her into it, but I'll carry on. I mean, if I think about an experience I've had, and only because you were so kind to share yours, in that sense, and I'm processing this notion of do we need them to understand? So
Yeah.
I've had ADHD since I was a kid. Took medication for years, and then when I came to this country, I kind of I'm not going to take my medication anymore. But what it meant is that I was just smoking tons of weed. You know what I mean?
Yeah.
And using weed the exact same way that I was using my ADHD medication. I needed my GP to understand, this white middle-class woman, to understand why I was smoking so much weed. I needed to understand ADHD, because she sort of had this notion of it being this kind of frivolous thing. I needed to convey to her my experience. And I think Joseph is right. I don't think she ever fully understood, but I needed to come to a space of understanding with her so that I got what I needed, which was a referral to the adult ADHD unit for her to kind of give me the process of getting my medical records from home so that she could then, sort of take that on board. So I think in some aspects of my life, I don't really care if white people or non-queer people and non-gay people, I don't really care if you get me or understand me. But in some aspects of my life, there's this weird compromise that I think that we, any of us who are, sort of marginalized and don't have, sort of, the right level of kind of equality in terms of service provision, we have to, because if we don't get them to kind of beyond empathy, I think, because empathy sometimes can sort of drift into pity. And that's a funny place to find yourself when you're dealing with health and sort of social services.
So Simone, we're just talking about, to catch you up. Thank you for joining, by the way. How can the experiences of the less well-heard groups be better, feed into the mental health services, social services, and health services that can provide better prepared support for them in the future? So we're just talking about whether they need to understand us. Oh, she's gone again. Oh no. Oh, bye Simone, we'll see you again. All right, again, audience, you feel free to message in the chat or put your hands up, being part of the discussion. We're going to move on to question 4. Okay, thank you guys for being so open, by the way. You don't have to answer the questions if you don't want to, but thank you for being so open. All right, so what changes are needed? Oh, number 4, my love. Okay. What changes are needed to make London a more inclusive place to live, work, and grow? So you touched on that a little bit in question 2, but just again, what changes are needed to make London a more inclusive place to live, work, or grow?
Shall I start?
Yeah, do you want to start?
I mean, as for me, this, just reading through the questions quickly before, but not really formulating fully realized answers, this was kind of like the question where it's like, okay, this is the white middle class question, like inclusive, like really, what does that mean? Like, I don't know. I think in itself, the question is kind of brushing over, the real material circumstances that lay behind equality, that lay behind the fact that Black and queer people are disproportionately experiencing mental health issues at this time. It's not really about being included or kind of on this cerebral level of like, okay, great, I can apply for whatever job I want. It's, I think really about addressing the structural realities, the structural oppressions that we're up against. So I don't know, sometimes it's hard for me to answer a question like that because it's so broad, but also because the answer is so broad. The answer is
okay, I'm going to ask you guys a different question to make it less broad. If you have the power to change one thing within these services that actually can make it inclusive and make it better for our community, just one thing that you think you have the power to change or can acquire the power to change, what would it be?
Oh dear, one thing.
Just one.
Can it be like this big kind of?
It can be as big or small as you need.
Is in systemic racism? Is that too big?
No, go on. Tell me more.
Yeah, because I mean, this is where I'm going to sort of steal Joseph's answer. I mean, I think his answer was actually spot on, because I think, you know, the big, huge issues are so complex that it makes the question a bit frivolous in that sense. I mean, when I looked at that question, I think the thing that came to mind, maybe because I'm reading a bit of too much Toni Morrison these days, is really this sort of greater awareness. What did I write down? A greater awareness of what othering does to people. And I think it's that, again, if I read that question, it's like, you know, what changes are needed to make white people more aware? You know what I mean? Like, there's so much of the work, I think, particularly in the context of that question, that's put on, you know, people who are experiencing these kind of inequalities. It's like, actually, we keep telling you over and over and over again what would make me feel more included. You know,
can I ask you both a question though? Do you feel like within our own communities we show unity, community, love, everything we're asking them to do for us? Do you think we do that for ourselves?
Sometimes yes, sometimes no. If you're fortunate enough to, I mean, community is such a broad word. Are we talking about like the Black community as a whole?
I'm talking about Black, I'm talking about queer, I'm talking about trans, I'm talking about communities who are unheard, unseen, who are asking for their rights back, who are asking someone to fight for them. Do you know what I mean? Those are the communities I'm talking about.
Yeah, I think, you know, if you're fortunate enough to find a group that you can consider that community supports you in London, then you can have that. But I think also, as I sort of said before, the reality is we're all so up against it in different ways for different reasons, but also for the same reasons, that it's not always possible to provide that support for your friends, or to it's not also, the community itself is so kind of dysfunctional or traumatized that how can we even sometimes gain the energy to provide that within ourselves for ourselves when we're, especially in a city like London, which I kind of work, sorry, just to ramble on a bit, but like the reality, like if we're talking about London, it's what do we need to make it a more inclusive place to live, work and grow? We need affordable rent. We need social housing. We need these kind of basic material needs that would enable us to have the space to do the work, to make our voice heard. This, you know, London is just, the way that, you know, like I can't even talk, but the way it's going, it's just such a difficult city to live in, to survive in. Someone working the gig economy, I mean, I guess I didn't choose the easiest
pathway
being a living, but at the same time, that's ultimately what's going to make me feel fulfilled. So I didn't have a choice. I tried the office job. It was awful.
Not for you.
It was
I hear
so
that.
bad.
Thank you. Thank you for sharing. I hear that. Antoine, do you have anything to say towards that?
No, I mean, I think Joseph has said things very, very well. And naming those things, I think, is very important as such. And there's so many things. It's like, you know, my inclusivity, and I think, again, borrowing from Joseph, if I feel included. There's my privilege. I live in social housing. I've got a decent job. You know, I can get to work and not necessarily have to use public transportation. So because I have those things, people's, you know, efforts to exclude me, it enables me when I go into my GP, because I'm not worried about my rent and I'm not worried about my work, to sort of say to my GP, you need to listen to me. You know, I don't want to smoke weed. I want to, you know, take my ADHD medication. You know, so to have that space and energy to be able to confront when I feel excluded requires all those things that Joseph just named. You know what I mean? I have to, you know, have a secure, and not only for myself, but I have to know, and again, this is why, you know, as you say, Joseph, social housing is everything. Because when you know your friends also have, you know, accommodation and people around you are safe and secure, then that also enables you to
feel good,
live your full life. Absolutely. And maybe because they ain't asking you for nothing, you know what I mean?
Yeah.
No problem getting friends out there who need to ask me for anything, but that's what I mean. If others around you are sorted, your community is sorted, and you're not having to worry about them as well as yourself, then it enables you to kind of speak up when you feel excluded around things. And I just think it's that thing around these, you know, that particularly that question that doesn't sort of recognize, you know, the real effort and work that it takes to just be queer.
You're both touching on like very self points, where Joseph earlier talking about how as soon as lockdown happened, you started doing self-care, self-worth, all that kind of stuff. And then you and Ton, you're talking about how your life is sorted, you got a job going still, you got an apartment, you're very much not carefree, but life is going well for you, so you're not having alternative stresses. So do you feel like self-love, self-care, community is something that we need to hone in on first before seeking demands? Because I know with my work that I do, I always focus on self and community first. It's like you sort your family out before you go out there and sort the world, because you can't go out there, try and be strong, try and tell them that we're united and X, Y, Z, our mental health is this and we demand that, if we can't even support ourselves with it. Does it make sense? That's where I'm coming from. What do you guys think?
I mean, I'll absolutely agree with you, and I think it goes back to that idea that if we worked together in that sense, and I guess this is what you were saying, it's like, do you feel support from, you know, people, other queer people and whatnot? I think, you know, other queer people know that if, you know, my mates and people know if they show up in my house, I'm going to feed them. You know what I mean? Like,
yeah.
So they know that, because I can go grocery shopping and I have a job that I do that bit, you know. So I think if we all do our bits in that way, so I think those things can happen simultaneously if we're smart about it. So there are people in our community who have the energy, the capacity, the resources to make those demands. I mean, we saw that a lot, but I think with some of these protests, you know, some of us can go out there and protest. Some of us, because of our health, because of, you know, fear of whatever, are not going out there. So those of us who can go out there and put ourselves on the line should do that. And I think that's a kind of metaphor for all aspects of life. You know what I mean? So if I've got the first people, and I do feel that way, the first people who will get what I got and are those who I know are most in needs, and those are people in my community. So I think those things have to happen simultaneously. Self-love is very important, very much so. But I think that people like me, you know, sort of taking all that sort of time to do, you know, self-love. It's a bit funny when you've got a job that gives you security. I believe in self-love. Yes, I put on my sort of records at night and do those various kind of, you know, nice little middle-class things that I know how to do as such. But I also think I'm aware that other people don't have the space to do that. So am I creating and doing things that enable those people to take care of themselves? And I think so. I think it's a simultaneous thing where we're all working together around those things.
Okay, so leading on to the next question nicely, what do we not have in place to listen to the stories and experiences of all Londoners, which would help develop support around your needs? So what do we not have in place to listen to the stories and experiences of all Londoners, which would help to develop support around your needs? So you're saying there's protests happening. Are they being heard? You're saying that you're saying middle class people, or people who are the community who have money or have time or have the means to go out there and make a say. Are they going to the correct places? Are there places out there for them to actually to go and support their community? So what do we not have? What's lacking, guys? Simone, would you like to join in? We haven't heard your beautiful voice yet. Thank you so much for keep trying to come back with us.
I love the persistence.
Yeah.
Can you say that question again, please? Sorry.
So sorry, you're just jumping in. I'm just kicking you into this. So the question is, what do we not have in place to listen to the stories and experiences of all Londoners, which would then help develop support around our needs? So the community's needs, those who are not heard.
What do we not have in place? We don't have, I say we don't have the middle grounds. So we have the leaders in a sense, and we have us, but there's no middle grounds for people to connect. So people feel like they're so far removed from the people making the decisions that they feel like it's kind of a thing where they don't actually express themselves or don't feel they need, you know, that's what I kind of see it as. So we need more spaces where people can be themselves and be heard and it's not just a tick in the diversity box. It's more qualitative research where people can express themselves, where it's not just
And who's people to you? What's the middle ground look like?
The middle ground. So the middle ground
Yeah.
are professionals, but for example, so the people that need support, maybe mental health, the mental health sector. The middle ground is the people like us who can be a part of the transition between us and the managers that are making the rules. Do you get where I'm coming from?
Yeah. I hear you. And Joseph?
Yeah, I mean, I totally agree with that. And there just needs, there's this complete disconnect by the people who are making the decisions and the people living with those decisions. I don't know what it looks like, but there needs to be some kind of forum or system in place where people can actually have the opportunity to express their needs and know that they will be heard. That's not just this process of, okay, you can write to your MP or your councillor, and maybe they'll listen, maybe they won't.
Have any of you even tried to write to the MP or councillor? Just a random question. No?
I've written letters to my MP, not usually as part of like activist campaigns where we're like flooding them with letters on a certain issue. So it's not in a case where I've like been expecting a specific response to me. And yeah, I mean, sure, it's kind of all you can do sometimes, but you're just writing your letter to your member of parliament who then might raise this issue in parliament amongst several thousand other issues that are being raised that are also on their radar. There's no, sure, we can protest, we can write letters. There's no sense of any kind of accountability for those people in power, or that they're actually going to follow through. So I don't know if it's about creating forums or.
Yeah, I understand that. I understand what you're saying with that. It's just like we do protests, we do a lot of events, we do so much things, but it's like, where is it going? That's the question.
Yeah.
When we're doing these things, it's about we have the right questions we're not having the right questions to answer. We're saying we want to change this, we want to change that, but I feel like we came with more structure. I started off small. Okay, we're going to start off changing one borough at a time, in a sense that we're going to, incorporate this and that. And then when we show that we can do it in a small scale, and then we can start hitting the bigger scales. But I think at the moment we get too excited. We want to change the world, but changing the world starts one step at a time. So I feel like that's what we need to look into more, opposed to the big picture.
I definitely agree. I feel like coming from a perspective of protesting and demanding, I feel like the community has been segregated so much into so many small sectors: the elderly, the queers, the young, the millennials. So we've been segregated so much. We're all demanding different things, but ultimately we need to come together and understand how we can create a structure for all of us, so we can all live happily in a way that we can flow around each other, but with the same respect, the support, the mental health, the health sectors, the family support sectors, trauma. There's so much that we need help in that we all share, but we're not asking the right questions or have a vision in the first place of what we need. So when bearing these questions in mind, I would love you guys to think about personally, have I asked the right questions? Do I have those visions? Or am I also asking without thinking what I actually want out of this? Just a quick reduce. Also, before we carry on, Simone, you didn't get to share with us a bit more about who you are and what you do. So can you share that a bit now?
Yes. So I am Simone. Hi. I'm a recovery coordinator. So I work with mental health, and also alongside people with mental health, we look at addictions as well. My job role is to look at every aspect of their lives and how I can help promote recovery, and signpost to different services and literally be the help mechanism for them to become better versions of themselves. That's what I do.
And talking about recovery now, so even with this question, it's talking about how can our experiences and stories help within these sectors. In terms of your supporting recovery and helping towards recovery, what do you do? Can you hear me? Oh. No!
Don't go,
Simone!
Zoom strikes again.
She's here. She has
Okay.
You make it so much better, Simone. You make it so much better. You can't leave.
I just ran upstairs. I use my phone. I was my tablet. I'm on my phone.
Okay.
So can you repeat that, please?
What do you do within your recovery sector that may be helpful within this? So what do you do to promote recovery that can promote the recovery of our system, the recovery of helping Black people or queer people, all the communities?
How I help? So one way I say I help is like the fact that I'm a Black woman in the role itself, because I feel like my clients need someone they can identify with as well. And I'm young as well, and I've got experience, so that helps. I also use a center approach where I feel like I like to empower my clients so they feel like they have control. I'm holding their hand in a sense. I don't take over the control. I give them a lot of ideas of how to recover. So it's more about, so they have a sense of control, but also when they come off track a bit, I try to bring them back a bit by like questions and like helping them their thinking more, because I know that again people like to be like, yes, tomorrow I'm gonna run a marathon, but it's about the steps.
Realism.
So realism, and it's about educating my other staff members and stuff like that for areas they're not so understanding on. And it's about community. It's about how the staff can help the clients and how much we can learn to help the clients. Like today, I was talking to my client today about how she feels about therapy and stuff like that, because she told me she's been on the waiting list for ages. So I said so we was talking about it for a while, and we were saying that there's a gap between the waiting list for therapy and actually having therapy, because she said she waited for a whole year, and the time she waited the whole year, she was back in hospital. So it's about the middle ground. So
what do we do in between that time?
So is there like there should be a middle ground before you go to therapy or something like that, where you can have like you can express yourself to someone, maybe out, I think that's what
so that kind of leads on to the next question nicely. So it's what do we not have? Thank you, girl. So it's about what do we not have in place which would help all Londoners develop confidence in social services, mental health services and support services. So that's kind of, for me, that's not encouraging. If I knew I had to wait a whole year, that would completely stop me from going to go see a therapist, completely stop me from seeking support with the doctors. I know you get put on waiting lists for time, and I know some woman who I met in hospital who gets holes, she had a fracture in her spine because she waited 6 months to go see the doctor because she was on the waiting list. The fracture turned into something more serious. So it always happens with these communities. So what do you think? You're saying middle ground and something in between. That's also a great point. That could be happening. Boys, what also do you guys think that could be in place that could support these things so people can be more encouraged to go seek help?
One of the things that I've appreciated with my GP's office actually is the service user groups that they have put in place. And to be fair, I haven't accessed them as much as I would want to, but they send out.
Any reason?
Well, because I maybe partly being busy. I guess my observation is the way in which they have, really sort of promoted it. You know what I mean? They send me text messages. I've gotten stuff in the post. I've even gotten a call. And I think there's been a real effort from my, sort of plug 'em corner surgery and on Cole Harbour Lane. I don't know if they're different, if that's happening in other GPs, but just by getting the invitation to be a part of a service user group says to me that you kind of, and I've never been to any of those sessions. I went to one of those sessions, thought it was fantastic. And having.
Sorry, just to interrupt. When you're saying peer, does that mean male, Black, queer? What is that? What do you mean by peer?
Peer. What do you mean peer? Did I say?
You're saying peer groups?
No. User groups. So my GP's user group. So service user group. So they just sort of not recruiting, but they invited anyone, it seemed, who uses that GP to come along and to sort of talk about the GP. The first
Okay.
session they had a bit of food, which was very nice. That's how you get me into the room. And,
Free food.
I mean, I love some free food. But just the effort that they made, it seemed, and I don't know if it was tokenistic, I don't know what it was. I think the other thing, and Simone, it really.
This happened during BLM blew up.
Yeah, well, and but it happened before that as well. I mean, really, for the last sort of 3-4 years, they've been doing a lot of work to sort of expand it. This user engagement group that they've got. I mean, no, it was before. And I don't know, for me, when I walk into my GP's office, I don't know what it is about the corner surgery on Coal Harbor Lane, but it always feels very black and brown and ethnic, and lots of immigrants there as well. You know, well, people who have accents from someplace else, sort of thing. So I don't know if it's the nature of that GP surgery or what have you. I mean, Simone, we really needed you from question 1 through 4. I mean, I think Joseph and I did all right, but goodness, you come into the room and thank you. But I think you hit it on the head too. I think it's that representation. I mean, representation is brilliant, because sometimes it's incredibly useful and powerful, and it's everything. Sometimes it's just tokenistic, but I think representation, if you don't see yourself, I mean, if you don't see yourself, then it's so much different.
Of course. That's another thing with professionals as well. It'd be nice to see more Black professionals or of the BLAME community professionals in high positions, because what's happening is the frontline workers are usually from the BLAME community, but then higher up, they're not. So it's like you feel like some people may feel limited in how high they can climb as well. So I think that's an issue that we need to solve as well.
It's true. I was trying to point out earlier, and trying to be subtle about it, talking about self-care. How do we help ourselves? We don't see ourselves anywhere. We don't support ourselves in general. Then our family, we don't talk about mental health. We don't go out there and seek help by our MPs. I personally feel like, yes, there is so much we are not doing within our community that we need to do for ourselves before even screaming and shouting about it. Because ultimately, as you were saying earlier, Antoine, these systems are put in place by white males who don't give a crap. And the more and more we scream and shout at them, the more and more they're going to be like, okay, guys, relax. Let me just give you 1 little 2 things to hush you up. But until we support ourselves, create education within ourselves, create community, create unity, create an economic system, create our own schools, health services, because with our own people who understand us and actually want to support us, there's not going to be real change, I personally feel, because how long, for generations, have you been protesting? Generations have been asking the same questions and nothing's been done. But what have we done for ourselves since then? That is the biggest question I feel like needs to be answered by someone. I'm joking, okay. Joseph, do you want to add anything before I move on?
Yeah, I guess like just on a really simplistic level, but like I think people, to have confidence in these social mental health support services, we need to know that, we need to know that they exist. We need to know how to access them. That means, you know, from the day you're in school, from being a young child, you need to know that these things exist. You need to know how to access them. You need to know when to ask for help. This is about, you know, supporting people from a young age until we leave this earth. And then we also need to not necessarily like that they work so much, but we need to know that we're not going to have to wait a year on a waiting list, because that I went through that. I was like, I need help. I'm going to look for it. And I'm told that I'm not going to get this for however, I don't even know how long they told me. It was like 9 months to a year or something. I was like, I can't do that. I need this right now. I'm going to
lose your mind.
So I had to do what I needed to do to find the money to find private therapy, which is like a lot of what a lot of my friends and peers end up doing, even if you can't really afford it. And now I realize, you know, it's the most important thing. I'm always going to make the money for that. So that's the thing. But the reality is there isn't money there. There are resources there. We just need them to be funneled into the right places. That means we have enough therapists. That means we have enough specially trained people to mean that we're not stuck on these waiting lists for so long.
So you're saying you went to go use mental health services yourself.
Mhm.
What services do you feel most confident in using currently or have used in the past? So me personally, I feel like, as you were saying, there's a lack of Black therapists, Black doctors, or even Asian doctors, or people of the lesser minority. And finding these services or even seeking for these services online is quite difficult. So what do you guys feel are out there or used in the past that have helped or you feel confident in using? It's a hard one. I'm sorry, guys.
I didn't know if this is specifically with regards to mental health services or just general London services, but I mean, I guess one thing that I can say is in London, although maybe there's too much demand and not enough supply, like their sexual health services are quite good. If you think about like Dean Street, when I first went there, I was like, this is amazing. And like they actually
it's like a club.
Yeah. Like, you know, all these like self-testing kits which I used recently, like there does seem to be like actually a lot of energy behind educating people and getting people to get tested. There's a lot of advocacy work going on, and so that I kind of find
good. I think so as well.
But you know, Dean Street is amazing, but there's so much demand for it. You have to be like, if you want to book for the Express, you have to be there at like 7 p.m. on the dot to text, and it's still hard to get an appointment because there's not enough like resource for the demand that there is. But yeah, I think sexual health services seem to be like doing all right.
Yeah, Antoine.
It's an interesting one because you know, part of me can be really cynical. And think to myself, well, you know, sexual health services, and I agree with you, Joseph. You know, coming to London, it's like, wow. But you know, it's also because it, you know, as a public health issue, it has a kind of priority in a way, you know, and so it isn't because they really want to help us. You know, I'm not so sure in that regard. And I had two experiences really in the same week, which was profound. One was sexual health at Dean Street, and I was coming onto the prep trial. And this kind of, you know, sort of young white kid comes in and he's essentially telling me that he might not be able to give me, I might not be able to give you prep. And I'm like, why won't you be able to give me prep? He says, well, because you're Black and ethnic minority, you have a disproportionately higher rate of kidney, and there's a different formula for you. And I'm thinking to myself, I'm like, why are you telling me this right now?
Please, like, I'll go through enough of my day.
Calculations. And I'm sitting there, I'm like, just disturbed by this. And then he does this calculation in front of me. He goes, oh, you're fine. And I'm like, real problem with that. And I said, you know, this is really, you know, sort of problematic. So of course he felt, you know, sort of implicated, and he goes to get the guy who heads up the prep study. He comes in, he goes, are you feeling that, you know, you're having a disproportionate? I said, well, yeah. And explain that to him. And he's trying to, you know, sort of justify this thing. A week before that, and this is again about representation, I think, in my GP's office, which I just sort of praised, and I was having my plus 40 test. So you get a wellness test after you turn 40. To be fair, I got it when I was 43. But
okay, girl. Okay, girl.
43. But the health practitioner sitting with me, and Black woman who says to me, I shouldn't talk to you about your cholesterol. And I said, why shouldn't you talk to me about my cholesterol? She says, because you're Black and ethnic minority. And I said, well, okay. And so apparently, because we have a disproportionate rate of heart disease and all these various things, that the number, because it's rationed, the number that would trigger a conversation about our cholesterol is higher than it is for white people. So the number was 30. So she says anybody above 30, and mine was 37. Anyone above 30, it's a problem. But it has to get to 40 if you're Black and ethnic minority.
Talk about it.
Yeah, to talk about it because they expect that from us. So I think in that way, the systems that they have in place, you know, does not, you know, sort of see us, right? It, you know, these numbers that they use. and those people who are facilitating that system without training and insight. So two opposite experiences in that sense, because this Black woman, she remembered me, perhaps because of my accent. I did the health and, what do you call it, the smoking cessation thing class with her. So she remembered me, and she started asking me questions, and it came down to the fact that I was eating like about, don't get me, 40 eggs a week. I loved eggs. 40 eggs a week. I was eating 40 eggs a week. But I would have never known that that was a problem had this Black woman not taken it upon herself to actually do what was against her job regulation. She was not supposed to talk to me about that. So it's how do we marry up these systems that actually are rationed, for efficiency, but disproportionately affect us? Because if you're white and it's rationed for efficiency, it's going to benefit you. And then those people who are in those positions who don't see that.
To change the question slightly then, so this may aim at Simone a bit as well. You're all talking about systems, we're also talking about the person. So without the person, they're helping you, you would never have known that. Without Simone being the person in the system, she would never have known these rights and laws as well. So do you feel like we need more people within the system to speak up for those who are out of the system? Do you feel like that will make a bigger stance or change? Because I know from my perspective, living in hostels, being homeless, being part of the sexual health community, all the systems are mainly these people who are screaming and shouting within saying, I can't do anything, I'm sorry, I haven't got the power because of, I was trained this way, there is no other training. Do you feel like they're the ones who need to speak up for us?
Yeah, I think you make a valid point, what you just said. I think you answered your own question there, it's very valid. But what I feel like as well is that there needs to be some form of education that tells us these things, especially as the Black community. It's like, okay, your rates are higher, so how are you going to support us to educate ourselves? So what education is out there for us to grasp so we can spread it? I feel like we find out things about ourselves as the Black community, and that we're quite different in some aspects. But it's like, how do we get the support? For example, with COVID, it was like the Black community is at higher risk, we heard. But it was like, okay, so how are we going to be shielded? How are we going to be shielded? How are we going to be protected?
How do we protect ourselves?
So it's like we find out these things quite randomly, I believe. And then it's like, so what do we do about it?
Do you feel like in your sector there's much, because you're talking about recovery earlier, do you have anything to do with prevention? Because there's not much prevention with the Black community. It's always just medicines and this and that. There's no real prevention for our traumas, for our causes, for our heart disease, for our cholesterol.
Yeah, that's what I believe. There's not much prevention because not much education being shared about it as well. Also, in terms of recovery and mental health in that sense, I feel like we need to look more back into maybe the upbringing as well, backgrounds as well, because there's so many ethnic minorities within hospital. I visited the other day, and it was a lot to see so many of one race in there. So it's about what can be changed, what's prevention, what's different about usually more of African inheritance in there, but what's so different about us or the Caribbean? What's so different about us why we're in there more than anyone else? So we used to look at all the aspects that can contribute to being hospitalized or being in the hostels in these situations.
I think that's a valid point. There's actually a debate on, I actually want to share it with you guys, maybe try and find it now and in the chat, where it's a debate you can find online, a TED talk, and she's talking about how they now take doctors in America are now going back in time when talking about mental health and health. So they want to talk about your childhood, your parents, your grandparents, how they ate, what their depression was like, because these things all manifest within us. And you're right, I think that's a valid point, and not many people actually think about that going into the past and how to help the prevention rather than what do we need now.
Of course.
Anything you have to add, guys, before I move on? No? Moving on then. Question number 8. How are you guys feeling, by the way? Everyone okay?
Yeah.
This is a bit intense.
It's very good for my mental health. I'm loving this.
You loving it?
Yes, it's good.
Okay, we're gonna keep going. We're gonna keep going. Keep the energy up. All right, question number 8. What do we need to challenge leaders with to ensure greater inclusion for those who are experiencing health diaspora? Can someone help me with the last one? Disparities.
There we go. Disparities.
Thank you, Queen. I couldn't read that one. So last time, can we get up on the screen one more time, honey? Because I messed that one up. Thank you, girl. Thank you, girl. What do we need to challenge leaders with to ensure greater inclusion for those who experience health disparities?
Do you want to do a definition for that?
Yes, so that is, I read it earlier.
Okay.
Groups that are of the minority, so groups that aren't having their voices heard, who are experiencing lesser care, not inclusion, segregation, all that kind of stuff. Those groups. Okay. So who do we challenge? What leaders?
Everyone's looking at each other.
You're muted, darling, so I'm picking on you.
So me. Oh,
yeah,
so I'm muting just because this isn't my house, so there's something in this kitchen.
This is not my house.
Girl, I'll bless that house. I'm gonna bless that house, girl. Don't worry, you good.
There's something in this kitchen that keeps beeping, so I've been muting in between. But I don't really know how to
the Babylon, honey.
to answer this question really, because it's like what do we need? We need to know that they're actually going to listen. I mean, like, for example, we've had this semi-report into the fact that Black, Asian, minority ethnic individuals are really being hit the hardest by COVID. Great, we found that out. What's being done? Absolutely nothing. It's same goes with, you know, I don't know how many years ago, but David Lammy did like a report into racism police, am I right? A thing. Again, none of those changes that he suggested have been implemented, or barely any. So it's like the processes of holding leaders to account kind of trundle along in the background, and there's a report and there's a headline and there's a protest and whatever. But at the end of the day, when you don't have a government who seem to give
Okay, I'm gonna switch this up for you guys a little bit, yeah, because I just want to ask the real questions a little bit. They're not on the list, but it's kind of a part of it. So my dad and I had a discussion recently, because he's a Black businessman and he does a lot of import and exporting. He's part of the chair board and all this kind of stuff. I'm always asking him, like, why don't you support Black businesses? Why don't you support Black people? And he always says the same things. They're not ready to be supported. So I always say, why? What do you mean by that? And he recently said to me that we demand a lot, we ask for a lot, but we're not willing to live by our own actions, which I was asking a lot, what can we do for ourselves? Because he's saying, if you generally wanted taxes to be changed, we will stop paying taxes. If you generally wanted the health system to be changed, we will stop going and demand change. They basically rely on our consumptions, our money, our time, our demands, without us actually giving anything to them. They can't take. So they will have to make changes. So do you guys feel, so from that, what do you guys feel we can do, or who do we go to? What can we boycott? What can we do action-wise that can cause real change, stimulate even real change?
I mean, I think I think you said it earlier, and I'm, you know, I'm with you. I'm always kind of careful how I articulate these things around, you know, doing for ourselves and self-determination and things, because it's what self are we referring to when we talk about that, you know, in terms of
talk about what self you refer to then.
I mean, and I think again, it's about a consciousness about, you know, because I mean, it's also is about this thing about how I feel about capitalism, full stop, right? And that's, you know, we'll put that on one side, but absolutely, I think it's about how we think about spending our money and our time and our energy, and that I think comes from conversations with each other. And holding each other accountable for certain things. It's like, do you know where that came from, and do you know what that costs to actually make that, and which is it would have a different impact if we're holding each other accountable in that regard. Because I'm not going to try to tell anyone what to do with their money and how to spend it, but I can also I think it's fair to sort of say, well, do you know where that came from? You know, buy it if you want to, but be honest with yourself about what is the impact of that purchase or the choices that you're making and whatnot.
Why can't you say that? Because we're technically telling these white Caucasian males who run everything to spend their money wisely, because it's technically our money. So why can't you tell your fellow brother or sister or queer friend or whatever they may be, whomever they may be, to spend their money correctly the same way? Because what they're doing is also impacting negative change.
I think I tell them what I don't do. I do not go to the Brixton Village at nighttime. Yeah. And mainly because I do not want to be surrounded by white people in what was once a very, very sort of Black community. I don't want to experience that. I don't want to spend my money in that way. But I'm not going to tell my friends, actually not very many of my friends find themselves in the Brixton Village in the evenings, but I wouldn't say don't go to the Brixton Village, don't go to Champagne and Fromage. But I think it also is, they know how I feel, and I think they know and they have a level of respect for me, and they value what I think, and I think that has an impact. Well, perhaps in their invitations for dinner, maybe that's why I'm not getting them. So I think it is a bit of a fine line in regards to that, because capitalism is powerful. It influences people in a very, very powerful way, and how people are affected by it. And we don't have that conversation, because I think
so just quickly,
yeah,
we're getting some people who are sending messages through. So one person said they just admitted that Black children are more prone to serious health risks linked to COVID-19, yet would they consider waiving penalties if Black families are anxious about sending their children to school? Unlikely.
No.
So it's a lot to do with, yeah, she's right. What do you guys think about that before we move on? Thank you for sharing. Keep sharing your comments, please.
Thank you. That's very interesting. It's just like, to me, my first initial thought when you just said that, I just felt like, wow, when do we get a break?
Yeah.
It's just like, even our children, it's like, what makes us so different? You know, what makes us so different? You know, we scream back, we're the same. What makes us so different? What's so different about our DNA? Why we have these health risks? Like, I would like to know more about the why behind that, because I don't know. It's just a question it. Why? That's a big question.
Well, do you know what's funny? Because I don't know about you guys, but during quarantine, I've done a lot of self-care because I was very, very, very unwell. And as I said, I didn't even have time to think about COVID. It was all about surviving. So I did a lot of research. I had to do a lot of research into how to support myself for my Black melanin skin, for my female body. I had to do a lot of natural food work, a lot of medicine, a lot of certain oils created from certain plants that certain people won't legalize, even though there's so much history proven that it actually helps for a lot of medicine, chronic illnesses, etc. So I did that for myself. Now knowing that, I'm educating other people about medicine in a way that is not chemicalized, that is herbal, that can treat you in a way that is meant for your skin, for your body. So unless Joseph did his own research and went to the psychologist, would he know? Unless Antoine did a certain thing for yourself, for your body, would you know? So it's a lot about, yeah, there's a fine line between what we shouldn't and shouldn't say. But if we know these things are in place to corrupt us, like capitalism, like extra consuming, like paying your taxes, XYZ, if we know these things are structures that are going to destroy us, why stay silent? It's about time now that we just stop using our energy only for the systematic bullshit, sorry for my swearing, but also for each other. It's about time that we speak up and rise up for one another so we can also help ourselves.
Yeah, but that's another thing
Oh,
as well.
sorry, Joseph, pronouns. Sorry, did everyone say their pronouns earlier?
Oh yeah, I actually forgot to say I go by they them, but
They them, amazing, honey.
thanks for asking.
Simone.
Oh, I am she, her.
She, her, Antoine.
Yeah.
I'm he, him.
He, him. I am Nala, they, them, we, she. Me, I don't mind, darlings.
Yeah.
Cool.
Yeah.
Thank you guys for sharing. Back to what we were saying.
Could I just? Oh,
yeah.
sorry.
Yeah, no.
I just wanted to bring it back to this question that was originally posed, though, because I'm quite into this idea of exposing. I feel like the question itself is kind of symptomatic, or shows what the issue is. It's talking about what can we do to ensure greater inclusion for those who experience health disparities? But the reality is not about inclusion in a system that isn't built to serve these people anyway. Like, that's not the way that we should be thinking about this. We need to think about how this system is reproducing these issues in the first place, producing these issues. So if you're coming from this like, oh, we just want to kind of welcome you in so then you can stop talking about it, that's not the way it's work, is it? Like, I don't know.
Yeah.
As I was saying, like, diversity can't just be a tick box, you know, just I was threatened by it, you know. It has to be, there's been more from it. So it needs to be more respected and understood what diversity actually means. I feel like everyone feels like they know what it means, but when you start getting more into it, you know, it's deeper. So yeah, I agree with you.
I think there's two things there, and one, I'm all about kind of dismantling things. Nina Simone, I love Nina Simone, and she says you got to learn how to get up from the table when love is no longer being served. And it's also that thing about, you know, and another Black woman said this to me, is that you have to stop trying to put your chair under tables that are not built for you. And so part of me sometimes thinks, you know, these things aren't going to change. You know, when you ask these questions about what do we need to do to get leaders, I think Joseph said that we have done. You know, there've been report after report after report. My good friend Mark, who's over at Love Tank, and they kept asking him, 30 years living with HIV, you know, wanting him to comment on COVID as a Black queer man living, you know, with HIV for 30 plus years. And he really struggled with it for about a week. And then finally, he came over to the flat. We lived in the co-op together, and he just spewed. And what he was spewing was, I'm sick of this. I'm sick of you asking me questions that you already have the answer to. You have the reports. And what do you do with that? Because the asking of the question is what exhausts us. And our exhaustion is what prevents us from kind of making things happen for ourselves, to take care of ourselves. So I mean, sometimes you just want to disrupt it all, don't you? You know, this is the academic who's very privileged, just saying these things sometimes. But yeah, I mean, it's a difficult one in that sense, because you can use your energy to try to voice and to say what's wrong, but then it's tiring. It's really exhausting, and for some of us, really tiring. You know, without privilege and without security and whatnot.
Can I ask you a question, Antoine? It's a bit personal. Feel free to not answer, just because I'm aware of time. I want to keep moving forward. You talk about your privilege quite often throughout. Do you feel sometimes you're disconnected from what other people are going through because of your privilege? Yes or no?
I mean, I think no, and I think privilege is a funny thing, because I think we could all try to find some privilege in our lives. You know what I mean? So, you know, I have privilege in this, and people would like to call me middle class sometimes, and I have to remind them, middle class people don't have a crack-headed brother who's always asking you for money as such. So, I mean, it's relative. I know in a certain context I have privilege, but no, I'm not disconnected. I have family members, and I grew up in the care system, and I work with, you know, young people who are trying to sort of make it. And I live amongst people who have had lives that have been filled with sort of, you know, sort of challenges as well as joys and whatnot. So I work hard to put that in perspective. And what I also do is I take that privilege, because I think that's what we all have to do, is to recognize the privilege we have, and how can I use that to benefit others in that regard. So I tell you that I'm privileged, and I'll tell people, you know, what my rent is, so that I can, and I say that partly because there are people in co-ops who will sublet it and charge double for what they get, right? So almost I say my privilege to hold myself accountable to things as well, right? So that I'll never be allowed to do those things, right? Because I'm not hiding behind that. But I think we all have privilege that we can examine. I mean, I wouldn't say that in a room full of with white people, but I don't know if any white people are here. I don't talk about my privilege to white people as such. They don't need to know about my privileges. But yeah, when I'm talking amongst people, you know, my people in that regard, I think it's important for me to point out. You can hear it in my accent.
But I think maybe they need to know about our privileges, because they need to know we're not all poor, not all crackheads. We have jobs, we have ambitions, we need to be respected. Not all of us are sitting there silent. Do you know what I mean? But sorry, I'm gonna move forward quickly because I keep asking you questions that aren't kind of related but related.
I was gonna say one thing about privilege. I feel like it's good that you say that, because there's some Black people who are privileged and they want to be so distant from. You know, they want to be so distant from people who are not privileged. It's like, yes, I'm privileged and you guys are different from me, in a way we're still all Black at the end of the day, and it's about bringing each other up, not causing divides. Yeah, there you go. Yeah,
thank you, girl. Thank you for the 10. And Swan, thank you for your privilege, girl.
It was
Okay, so number 9, describe a news headline that you'd like to see in years' time. This could be a city-wide headline or something more specific to you and your community. Oh, I like that one. So a headline that you think could come in years' time, that could be in your community, something close to you, something like, boom, Trump, all of the man gone, disappeared forever.
I would love to see a headline that says, blame mental health, well-being, and employment on the all-time high.
Wow.
Yes.
Yeah.
I'd love to see that one day.
Yeah.
I like that.
Absolutely.
Before you guys speak, quickly, audience members, please keep typing. Please keep, I want to hear your voices, what you have to say about this. Can you please write some news headlines that you guys would also like to see? And if you want to speak, please put your hand up and you'll be added to the chat. Everyone, anyone else would like to speak?
What, about the headline?
Yeah.
Oh. Well, we haven't spoken about it much in this, but when I did these questions before with Hakeem, my headline was about, I don't know what the headline reads, but like, just, I think a lot about needing like community spaces and like the lack of them in existence. And I was doing a bit of reading recently about the Greater London Authority in like the 80s and stuff. And there used to be just so much more funding and money and actual spaces where people can get together and exist and commune. So for me, yeah, it would be like X million pounds have been put into producing community spaces for Black and queer community, something like this. I don't know.
Mm-hmm. I like that. Someone just messaged through. I'm going to read it out loud to everyone. When talking about being middle class, you're referring to a patriarchal system that was constructed to uphold institutional racism in Britain. Isn't it about time to stop using old-fashioned terminology to dissolve these systems and move on to an equal, inclusive future? So even with Simone, I just want to highlight slightly that you said BAME is on the all-time rise. Why don't we just get rid of that word in general? Why do we have words? Why do we even ourselves use these words that show systematical racism? So just to challenge you real quick, think of a way you can restructure that without using word BAME.
All-time high.
Yeah.
How do we structure that? Improvement, I guess, or an all-time high, like improvement, you know, progress.
Progression.
Yeah. Progression, yeah, because
Yeah.
it's quite ambiguous. Progression is it's going the right direction.
Yeah.
Yeah,
I love that.
the progression.
Antoine?
Yeah, I was reading that as it came in as well. I mean, language. First of all, I didn't say that I was middle class. I said I'm very not middle class. But I also think that language is a funny one, like statues, and I think it's an interesting one when we just kind of erase things, because I work in education. You know what I mean? I think it's where we position that. I think she's absolutely right, and I'm going to assume it's a she. They are absolutely right in the sense that it is, sort of tied to something historical. And I think actually that's the problem that I have with it, because if, people think if you make a certain amount of money, if you have you live in a certain area, then you are this thing. And actually, to use that as a starting point. I mean, I'm sure a lot of my colleagues at work might use that word to refer to me in that regard. But if they did, I would read them for filth, and use their language in order to do that. Thinking about a headline though, and also about sort of language as it were. I mean, I want to see headlines that validate certain things. So I mean, I'm thinking of the Advocacy Academy in Brixton, and they did this campaign where they made these mock metros. They made like 5,000 of them, like looked like the metro, and they put headlines up there like thousands of pounds giving to anti-colonial educational curriculum development, and they handed all of these out at rush hour. I mean, the impact that had, because people are reading this, they were confused. They were confused. Yeah. Of course, that hasn't happened as such, and so confused that apparently it got the education minister's attention, and they got a call to have a conversation about the curriculum. So I want to see these kinds of headlines in the future, which are so incredibly aspirational, that tell the truth. Yeah.
I love that. Okay, and we're out of time. We've only got like 4 minutes left. So I want to open this up for a Q&A to the attendees who attended today. Thank you guys, panel members, again for sharing and being so open. So audience members, please don't worry about spelling or being incorrect or feeling like you're going to be judged. This is about open discussion, truthful discussion. So to everyone, last question. Do you think it's possible to build back a better and brighter future? And if anyone has any other questions you want to ask the panel members, please feel free to ask those as well. Well, this one I'm going to share today is, do you think it is possible to build back a better and brighter, fairer future?
You first.
Simone, I'm picking you.
I mean, I would love to hope so, but I'm quite pessimistic about this question, because I feel like change is coming, but it's like we take 2 steps forward and 1 step back. So sometimes we feel like we're progressing, and something happens and you're like, oh, maybe we're not progressing as fast as we thought we was. So I don't know, I just feel like, I hope so, but I'm quite cynical about this currently.
So
yeah.
Oh, we ran over a bit, no worries. Okay, cool. So we can take a little bit more time on these questions.
Do I think it's possible? Yeah, absolutely. I think it's possible. Do I think it's likely? Again, I'm with Simone, I'm less optimistic about that. I don't know. I feel like all my questions have been like a low-key anti-capitalist rant, but I don't know, if you think about the amount of money that was, for example, given to bail out the bankers after the 2008 crisis, or it's not a case of resources not being there, it's just the way that they're being leveraged and the way that money is being channeled. So obviously, yeah, of course, I think it's possible for to build back a better and fairer future. I don't have so much for that being the case, because I don't have much faith in the people who are making those decisions, as with regards to who they are wanting to serve, and that is not Black or queer people, in my opinion.
Antoine?
So, yeah.
Yeah, I mean, I'd have to echo all of that. I mean, I think, yeah, I think for me, that question is, for whom are we talking about? I think that we're in this kind of age where people want to highlight how much better things have gotten for, whatever group. I think there's this thing about kind of being respectable, you know what I mean? So if you're respectable Black, if you act in a certain way, so it's like, you can do, you can have a better and fairer future if you work hard and you participate in the, and I think that other part of it is, people who are in those positions of representation and who could help, that, you climb that ladder up, and then people seem to pull it up, and then they stand up there and tell you, be like me, and so I don't know, I'm echoing what has already been said. Sure, it's possible, but can people be themselves, and will people get the kind of support that they need to be themselves? And I'm not so sure. People's mental health is very fragile because there's no validity in who we are. And what we have to model ourselves on is very neoliberal. It's like, don't try to dismantle the system. Just, buy yourself some candles or buy yourself some new shoes and you'll feel much better.
Do you know what's interesting though? The reason why I'm so passionate about our people helping our own people, because the reason why I started my company Hope is because I was so tired of going to these protests, hearing people scream and shout to systems that don't care, that I was like, whoa, I know so many Black doctors, I know so many Black psychologists, I know so many people who are in positions of power and help, who have the resources, may not have the money, but have the resources to help. So I said, what do I do now? I got all these people together. I said, okay, let's do this. Let's go and help our community. I set up my own system and now I'm making that change. So the reason why I'm so system, go away is because we don't need those systems in place. They're testing on their own, supporting their own, taking our kidneys and helping their own. Everything they're gonna do is not to support us. So the reason why I'm screaming and shouting right now about helping our own, because it's possible. All it is a system that they've created to support their own. The people who are funding it is us. So what do we do with our money? Which is what I'm saying. It's all about economical development within our own communities, is shifting our money into our own schools, our own hospitals, our own communities, mental health services, sexual services, housing, because it is there. There's so many Black bankers, there's so many Black landlords and communities out there that are looking for help and looking for support, but we don't know where they are. So it's all about seeking those answers as well. I'm cautious of time. Anyone want to have their last pointers? Anyone got any last pointers to say? No? So thank you guys so much, seriously, for coming on the panel today. I want to big up again LD and Thrive for allowing us to answer these questions, and hopefully these questions are going to be useful for some good, I'm hoping, there. And also Brixton Reel Film Festival, thank you so much for allowing us to do this opportunity, and the organizers today. I hope everyone learned something today, is taking away something about their actions, about what they can do, or what they think their power is now to speak up and rise up for our community, or what they have been doing, and just giving yourself a pat on the back for that. Big up yourselves, panelists. Can you go give yourselves a round of applause? Thank you for coming.
Thank you for having me.
Thank you.
Thank you, girl.
I wish it was longer, but thanks for having me, guys.
Love that. Loved it.
Brilliant conversation. Yes, definitely, Alice. Thank you. So all attendees who joined the webinar today and also who spoke today are entered in a prize draw. Don't know if you can hear that, I'm drum rolling. You'll get a little special hotel dinner for two. I'm not sure when that's coming up, but I'm sure you'll be alerted about that. Thank you guys. Have a great evening. Enjoy yourselves, look after yourselves, stay safe, and try and support yourself so you can support the community.
Indeed.